It's the fear or the belief that you have a serious illness that's based on some misinterpretation of normal
Right.
bodily signs or sensations, and it doesn't respond to
And it
reassurance.
has to last at least 6
In the
months.
last 6 months,
And if it
exactly.
lasts less than 6 months, then it's like some transient hypochondria, which a lot of us experience in life. I remember one day I woke up and my arm was swollen, and I thought, wow, what's causing my arm to be swollen? And I thought, why is my arm swollen? It's clearly swollen. It shouldn't be swollen. And I didn't know. And so I'm going into work and I'm thinking, well, what are all the possible causes of a swollen arm? And I'm thinking of blocked lymph nodes, and I'm thinking of tumors, and I'm thinking of a variety of things that are not very happy and exciting and wonderful to think about. And I'm not a hypochondriac, but I was somewhat concerned because it shouldn't have been swollen. So I'm going around talking to my friends and mentioning my arm, and they're laughing at me. And I don't think that's very nice, but they were. And then I was a resident in psychiatry at the time, and I asked my supervisor. I mentioned it to him, and he was an excellent supervisor, and he did what all good physicians should do, which is take a history. So they said, well, what were you doing this past weekend? And I said, well, there was a storm, and it knocked down the big branch from my apple tree, and so I rented a chainsaw and sawed up the tree. And he said, oh, well, that explains it. And I said, what do you mean that explains it? And he says, well, you have vibratory myositis. And I thought, wow, what is vibratory myositis? He says it's inflammation of the muscle tissue, and it was caused by the vibration, and that's why the fluid inside the cells came out of the cells, and that's why you have swelling, and it will go away in 2 days. So I felt so relieved after he gave me that diagnosis. And unlike, I guess, what the hypochondriac experiences, I actually did feel sustained relief. And it was also particularly helpful that the swelling did go down in 2 or 3 days. So anyway, that's an personal example of transient hypochondriacal concerns that are a normal and I think appropriate response when something physical is happening to you.
Yeah, I think that's the point, that if it's transient, it's absolutely normal. And in fact, there's a lot of literature actually looking at medical students. It's very well known that medical students often will develop the symptoms of a patient whom they can identify with. Often it's a patient who's from the same hometown or the same age or whatever. And medical students will have the symptoms and become pretty convinced they've got the illness that their patient has. But it's been shown that it's not related to any kind of permanent long-term problem. It's part of the educational process, the stress of medical school, and the learning that symptoms can have really ominous causes. So the example I was thinking of as Brian was talking was my roommate in medical school when we did neurology, and we're talking about brain tumors and all these horrendous things, noticed that when he went to shave in the morning, he looked in the mirror and he noticed that there was an asymmetry in his face, that one side of his face didn't look quite like the other side, and was convinced at that point that he had a brain tumor, because that's the kind of thing we were studying. Well, obviously, he had been looking in the mirror every morning for years and years and years. It's not till you learn that brain tumors can present with that sort of symptom that you then decide, oh my God, this is a symptom of a disease. But, he went and saw somebody and they said, no, look at your driver's license from years ago, and it had exactly the same droop on one side of his face, and the problem resolved.
Good. So we were covering today the history of hypochondriasis, and modern psychiatry does actually recognize it as a real disorder that is amenable to treatment. And Dr. Harding, you can tell us, how should people find help if they're looking for help?
Well, they could certainly look on our website, there's actually 2 websites for those in the Boston area, thehealthstudy.com, and for those in the New York area, illnessworry.cumc.columbia.edu. All right, thanks. And I'd encourage you to check out our other segments as well.
Thank you very much.
Thank you.